Speaking with a public health enthusiast, Eva Perry. Thank you so much for joining us on TVC News at 6. Well, today...
Thank you very much for having me.
Right. Today, the world seems to be off track from delivering on the shared commitment to end HIV and AIDS by 2030. Do you think this commitment is still likely going to be achieved come year 2030?
Oh, well, the goal is to achieve an end to AIDS by 2030. However, we know that the current pandemic may have shifted the focus from HIV/AIDS. We still hope that the focus would remain because HIV and AIDS hasn't left us completely. And so we must manage resources to tackle that, the current pandemic, which is the COVID-19, and also tackle the existing pandemics, which one of which is HIV and AIDS, so that we don't have a repeat of an escalation of AIDS, which is currently, as we speak, experiencing a decline.
Right. Statistics has it that 38 million people with HIV are infected globally. We have 1.8 million of them in Nigeria, and among them are 150,000 children. What has been the challenge so far in combating HIV and AIDS in Nigeria?
Well, the challenges to combating HIV and AIDS in Nigeria remains poverty. As long as we have people living below the poverty line, we would continue to have a rise in HIV and AIDS. So we need to provide employment. We need to encourage people to become entrepreneurs, women and girls especially, because they make up about 50% of the population, of the entire population that is affected with HIV and AIDS. We also need to get people to be aware that they need to get tested, because if you're not tested, you don't know your status, and then there's a possibility for you to further transmit the disease. We also need to talk about the issue of stigmatization. People need to allow people who have tested positive need to be inclusive in our day-to-day activities as a nation. We cannot they cannot experience stigmatization, and then we expect that other people would want to go test and also want to reveal their status to us. So we must encourage people to get tested. We must also be accommodating to people living with HIV and AIDS. It's not a death sentence.
That's just one thing. The issue of stigmatization is something that they're still grappling with. But then how can we contribute, or what more do you think we can do to contribute to the efforts to conscientizing people and remembering those who have passed today?
All right, so one of the ways we can contribute is to continue to educate and sensitize people. People need to be educated. They need to know the options available should they test positive. We need to create employment opportunities. We need to empower our women and girls. We need to also stop discrimination, like I've also said. People living with HIV and AIDS need to be accommodated into the society. Also, we need to improve our health system so that people can better access treatments for HIV and AIDS.
Well, makes sense. Thank you very kindly for that insight, public health enthusiast Eva Perry. Thank you so much for speaking with TVC News.
Thank you very much for having me. Have a good day.